Hey, Mulvinaka, and welcome to another episode of Health Talk with Oceania Hospitals. I'm your host, Alex Navilat. Massive Nakavakalevu to all of those that have been following our social media pages, and especially right here on our YouTube channel, Vinaka Vakalevu. Today, we've got a very special guest here with us in the studio, Dr. Aman Malawat. Doc, welcome to the show. How are you?
Thank you. And Bulavinaka, Alex, and to everyone.
Thank you. For those of you watching, if you have any queries, comments, questions, feel free to drop it down in the comment section right below, or feel free to drop us a message. Just before we start, could you kindly briefly just introduce yourself?
Sure. So this is Dr. Aman at your service at the moment. I am the anesthesiologist, intensivist, and the pain physician at Oceania Hospitals.
Thank you, Doc. Just before we move on, could you briefly just tell us about your scope of work here at Oceania Hospitals?
So my scope of work are under the departments of anesthesiology, where I often cater perioperative management for a wide variety of patients, which includes perioperative optimization, care, and the advances during the surgery and afterwards. Then the second scope is Department of Intensive Care and Critical Care Medicine, where we usually manage complicated and critical care cases related to some endocrinopathies, sepsis, shocks, multi-organ dysfunctions, toxicologies, and a wide variety of spectra apart from that. The third department that I cater to is Department of Pain and Palliative Care Medicine, where we commonly cater the acute and chronic pain and the ailments with interventional pain management techniques.
Thank you, Doc, and we'll dive into that in a later episode throughout this season. And could you briefly just share with us some of the challenges that you've faced?
The interesting fact about science or the medical practice is that no matter how diverse the pathology might be, that means the spectra of disease, the pathophysiology, the pattern remains same. So it's about the presentation, the subsets of the patient and their presentation, and the common pathologies that are prevalent at a local space that makes it interesting but appealing at the same time. So these are the challenges, like the presentation and the subsets that are usually commonly prevalent here.
Thank you. And to those of you who have been watching, and if you've popped into Oceania Hospitals, or if you have been following our social media pages, you've noticed that we've had an advert out on pain management. So Doc, could you briefly describe all the pain management services that we've got here?
Okay, so at the moment we are operating the outpatient based pain management and offering the services in terms of acute and chronic pain with interventional pain management on the daycare basis, which includes a wide variety of the illness, starting right from a simple headache to migraine or complicated headaches to neck ache, costalgia, arthralgia, neuropathies, neuropraxia, PIVD, spinal deformities, just to name a few, and herpes simplex or herpes zoster resulting into neuropathies, diabetic neuropathy, and the most common and prevalent sciatica and other spinal related issues.
Thank you, Doc. I think I might be coming and booking an appointment with you in terms of pain management because I've got a severe migraine, but could be due to the excess consumption of cover. But we'll get into that later in another episode. But thank you very much for that. Just before we go, could you share with us a word of advice for our patients that come in, just in terms of preparation?
Yes. So advice in term to the patient depends upon the department to which they are actually seeking help from. So if they are coming for anesthesiology checkup or are scheduled for a surgery, they will definitely lie under the scope of Department of Anesthesiology. So they need to have a pre-anesthesia checkup for optimization so that they can have a safe perioperative period, which is very important. By that, they can have their heart out for all the questions, queries that can result into some anxiety during the perioperative course, and that can result into a good outcome if solved at time. For patients who are coming for their scope in intensive care medicine or the critical care medicine, they usually do not have adequate time to prepare for themselves because they come as an emergency. and they will be needing acute care for optimization. So no adequate, I won't say there is a scope of some advisors on that part, but just a message that we are there to help you in all the scopes, be it the interventional or the invasive or the non-invasive management related to any of the cardio, renal and pulmonary support that you might need in this place. For patients coming to pain and palliative care services, yes, you need to come with all your investigations, the previously sought treatments and the previously sought consultations, so that we can discuss on the tailored program that might lie in the comprehensive plan to cater your services well.
Thank you very much, Doc. Well, there you have it, ladies and gentlemen. Like I said again, if you have any queries, questions, or comments, please feel free to drop a comment right here on this video, and especially right here on our YouTube channel, or even drop us a message right here on Facebook. But if you're around town, swing by to 120 Amy Street, Turek, where you can come on down and check in at our reception. And if you do need consultation or advice from one of our doctors, feel free to do so. So from us here at Health Talk with Oceania Hospitals, till next time, Vinakova Kalefu.